Cannabis, the gateway to treatment for opioid addiction, a feasibility study run by Alexis Flum. This study will be answering the question of if it is feasible to integrate medical cannabis into Colorado's medication-assisted opioid addiction treatment facilities. Opiate addiction is something that can affect anybody, whether it's somebody buying illicit drugs off of the streets, like heroin, or somebody suffering from a sports injury and needing a prescription for painkillers from their doctor. The form of the drug plays no role in addiction when it comes to opiates, whether it be that person who is buying heroin off of the streets, or that person who's taking medication as prescribed by a doctor to treat pain. Each individual is posing the same risk for dependence to the drug, not only physically, but mentally as well. The risk of addiction to opiates shows no match to the risk of fatal overdose. In the last year, the rising rates of overdose have been brought to public attention in several political hearings. Opiates have become, over the last decade, solely responsible for these overdose-related death rates. Once an individual becomes aware of their substance abusing tendencies, they are left with an important decision. They can either continue on with this addiction and risk a fatal overdose, or they can choose to end the use altogether. Continued use does pose some serious threats, but the repercussions from the decision to quit can become overwhelming and seemingly impossible to conquer. Once an individual discontinues use, they go through what is known as the detoxification process, which has side effects that are commonly known as symptoms of withdrawal. Ending the physical dependence formed by the body can result in serious pain, such as low energy, irritability, anxiety, insomnia, abdominal cramping and pain, nausea and vomiting, and also muscle aches and pains. These symptoms often become too unbearable for addicts. It is nearly impossible for them to discontinue use without seeking help from a medical professional. Across the globe, rehabs, treatment facilities, and medication-assisted clinics provide addicts with a variety of options for treatment. All of these resources typically share a few common practices, specifically those of which are designed to help ease the detoxification process. Unfortunately, in the United States, those methods can result in a very undesirable way. Once the decision has been made to end addiction, the most difficult of all decisions, an individual will be faced with a physician that is trying to prescribe the medications such as Suboxone and Methadone, medications which pose the same risk to an individual for a physical and mental dependence, fatal overdose, and opiate-like highs. These opiate-like highs play part by the fact that these drugs are still classified as opiates, although meant specifically for withdrawal processes and advertised for short-term use. Many individuals will find themselves dependent to these drugs and taking them for periods as long as years. After considering all of the risks posed by today's medical treatment for addiction, you would have to wonder, what's going on in Colorado? Patients here are taking advantage of a less traditional form of healthcare system. Medical cannabis, the cousin of the poppy flower, the originator of opium. Several points of criteria in this study are going to be used to evaluate and determine if doctors can start suggesting this medicine as an alternative to the ongoing opiate recommendations here in Colorado today. The first step used in determining the feasibility of this type of program was determining who can recommend cannabis in these care facilities. After thorough research, documentation was obtained from Colorado's Department of Public Health and Environment, which states that any physician with a valid license to practice medicine in the state of Colorado retains the right to make medical marijuana recommendations to patients. In the state of Colorado, guidelines are provided to physicians for making medical cannabis recommendations to patients. The surprising thing, though, is the fact that these symptoms, which physicians have been treating cannabis patients for, are the exact same symptoms which can be experienced by somebody going through a form of opiate withdrawal. So long as a physician decides to follow the regulations laid out by the state of Colorado, the next question would be, where can these physicians legally perform this practice? Treatment facilities can be run in one of two ways. They can be funded either by the government through grants, or they can be privately funded through other organizations. So long as a facility is privately funded through other organizations, they retain the right to make their own decisions as far as programs and procedures within the facility themselves. Another point to determining the legality criteria of this type of program is determining if there are any considerations that need to take place to keep it within the restricted guidelines laid out by the state. A few other states have begun taking the initiative on this type of program, specifically Maine, who has decided to make all of their practices revolve around the recommendation for medical cannabis cards. The guidelines established by the state of Colorado for medical cannabis card recommendations not only provide a more legal route for practices to follow, but also a direction that could be more affordable for the patients, and also touch base on patients under the age of 21 who are suffering from addiction to opiates. Ever since the war on drugs began, cannabis began forming a notorious reputation for itself, with harmful stereotypes and misconceptions that have kept cannabis skeptics on the edge in terms of legalization. This point of criteria will address those issues and provide alternative solutions for them to assist in the introduction of the cannabis treatment program. One of the most well-known misconceptions attached to marijuana is that it is a gateway drug, or at the very least a trigger for most addicts to use harder drugs. In reality, the introduction of this type of program will provide an outlet for patients, keeping them off of the streets and away from the illicit drugs which are being sold by dealers. The next misconception is that marijuana is addictive, that some people smoke the moment they wake up even. But in reality, it is not physically addictive as opiates are, or as their withdrawal medications are. If anything, marijuana is a habitual medication just as any other form of medication prescribed by a doctor. The third misconception is that marijuana can interfere with one's ability to participate in daily activities. Some people waste their entire lives away on the couch getting stoned, they say. In reality, the ability that one has to function when under the influence of opiates is much harder than it is for somebody under the influence of marijuana. If the concern is that a user is going to be lazy and unable to participate in their daily functions, then they would be prescribed to a sativa strain, which is specifically designed to energize and help a patient focus. One of the last misconceptions attached to cannabis is that it induces anxiety and paranoia. The sativa strain that I mentioned previously is one that can also raise your heart rate and induce anxiety and paranoia. If you have a high THC content strain of marijuana, as well as one that is more sativa dominant, the chances of a patient becoming anxious or feeling as if they are on the edge is a lot higher. In this type of program, these things will be brought to attention, and those who have these issues or underlying issues would need to be prescribed a strain of marijuana specifically designed to help treat their needs. To date, the cannabis industry has been running off of common knowledge. Most of the things that you will see attached to the jars as far as the effects of each strain are those based off of personal perceptions, not the scientific research which they need to be supported by the government. Now we're going to take a look into the criteria to see if there are any other researchers with a similar objective as far as treatment of pain or addiction with the use of cannabis. The question of cannabis in the treatment of chronic pain is a question that was also raised by Dr. Emily Lindley in the Department of Orthopedics at the University of Colorado School of Medicine. She herself evaluated that after medicinal legalization in Colorado, her patients were expressing that they were using cannabis to treat their pain at home. She ran a survey on her patients to see exactly how many of them were using this as their form of treatment. Her results came back to 20% of her patients saying that they use cannabis at home and it helps them treat their pain. Dr. Lindley has decided not to stop there. She is going to follow up with more research studies to evaluate pain treatment with medical cannabis. And she is not alone. You can find a list of the Colorado state-funded research studies going on today to determine exactly what cannabis can do to help patients in a medical way. To conclude this feasibility study, it is reasonable to assume that legally the feasibility of this type of program will be a little bit difficult. Just as in any program that involves cannabis, there is a lot of work involved and many loopholes to jump through. So long as a facility is privately run and has the facts and a program laid out which is going to be more beneficial for their patients than what they are already receiving, then there are very good chances that a program could possibly introduce medical cannabis recommendations.